Good morning, ladies and gentlemen, and welcome to the Tobacco Dependence Treatment Best Practices and Recommendations conference call. Your host for today is Melissa Ottinger. Ms. Ottinger, you may begin.
Good afternoon, and welcome to today's webinar presented by MPRO. This webinar is part of our Michigan Cancer Control Initiative, which aims to improve cancer screening rates throughout Michigan. If you would like to learn more, please visit cancercontrol.mpro.org. I would like to introduce you to today's speaker. Today we have Patricia Heiler, Public Health Consultant from the Tobacco Section of the Michigan Department of Health and Human Services. Ms. Heiler is a public health consultant and coordinator of the Health Systems Change for Treating Tobacco Dependence Project. She's worked at MDHHS for almost 8 years and has been involved with the Tobacco Control Program for 3. Patricia earned her master's in public health from the University of Michigan in 2001 and holds certification in health education and quality improvement. At this time, I would like to turn it over to Patricia. Patricia, if you'd like to begin.
Yes, good afternoon, and thank you. As Melissa said, this presentation is going to provide information on how to treat tobacco use and dependence in accordance with the United States Public Health Service Clinical Practice Guidelines. Throughout the presentation, I will provide examples and tips on how to integrate tobacco dependence treatment into your system of care. By the end of this presentation, each participant will be able to properly refer tobacco users to the Michigan Tobacco Quit line, accurately assess tobacco use and advise patients to quit, present a convincing argument why tobacco dependence is considered a chronic disease, and identify how the 5 A's can be integrated into the healthcare delivery system, existing administrative and clinical infrastructure. It is important to set the stage for this presentation to remind all of us on this call that tobacco use remains the single largest cause of preventable death and disease in Michigan, and we all play a key role in treating those addicted to tobacco. Tobacco dependence should be considered a chronic disease because it is similar to other chronic diseases that you treat, such as diabetes, heart failure, hypertension, and hyperlipidemia. It is similar because in all of these there is an expectation for remission and relapse, and for smoking alone it takes as many as 7 times for an individual to quit using cigarettes for good. And the ongoing treatment provided for tobacco dependence is similar to the treatment of diabetes, heart failure, hypertension, and hyperlipidemia as well, because this treatment specifically involves providing advice, intensive counseling and support, and pharmacotherapy. Tobacco dependence should also be considered a chronic disease because there is a spectrum of disease severity. Effective treatments are available, including high-dose and multi-drug regimens that are necessary to achieve the target goal. And similar to other chronic diseases, this treatment may require referral to specialists, and individualized therapy is very important. Also, for this presentation, I wanted to remind all of us that nicotine is not only a chronic disease, but it is a drug of addiction. As you can see from the slide, nicotine reaches the brain in 7 to 10 seconds, producing that feeling of euphoria without an outward notice of a user being stoned or unable to participate in daily life. This feeling is immediate, and it reinforces drug-taking behavior. Nicotine activates reward pathways throughout the brain, and it also allows users to titrate this dose to achieve the desired effects and continue this feeling of addiction. Young people in your practice that you see every day are particularly vulnerable to nicotine addiction. Approximately 3 out of 14 smokers continue smoking into adulthood, even if they intended to quit after just a few years. It is important to remember that 95% of adults began smoking before age 21, and 4 out of 5 become regular daily smokers before age 21. Studies show that early onset tobacco use makes it harder to quit later and harder for all of us to do our job as we treat individuals that are using tobacco. Which brings us to the reason that we're here today. Clinicians play a very important role in treating tobacco dependence. It is important that the treatment be delivered by a variety of clinician types, as this has been proven and documented extensively in the literature to increase abstinence rate. According to the U.S. Public Health Service Clinical Practice Guidelines, treatments delivered by multiple types of healthcare providers, such as nurses, medical assistants, psychologists, social workers, and dentists, are more effective than interventions delivered by a single type of clinician. It has been noted as well that as few as 3 minutes of counseling or other primary care intervention can increase the success rate of smoking cessation. It is important that as you go through this presentation today, you consider what staff is currently holding the various roles to do tobacco dependence treatment, and potentially who new you could bring on to the team to successfully complete all the components discussed in this presentation. 5 major components of tobacco dependence treatment are oftentimes collectively referred to as 5 A's. The clinical practice guidelines go into great detail on these 5 components, assist healthcare providers in knowing how to actively accomplish all the components, and how to ensure that the health system they're working in has protocols and procedures in place to assist them in accurately asking about tobacco use, advising to stop, assessing willingness to make that quit attempt, assisting in the stop, and arranging for follow-up visits. As mentioned earlier, the physician need not deliver all elements. One clinician, such as a medical assistant, may ask about tobacco use status, and a prescribing clinician, perhaps a physician, a dentist, a nurse, practitioner, or physician assistant, may deliver personal advice to quit, assess the willingness to quit, and assist with medication, but then refer the patient to a health educator to have the tobacco intervention in motivational interviewing done. The components should be clearly detailed in physician descriptions and included in performance evaluations of all staff. This shows the importance by the healthcare system for tobacco dependence treatment, and it makes all staff accountable to participate in tobacco dependence treatment. Throughout this presentation, I will give you practical ways to ensure that all 5 of the components are fully integrated into care and sustained over time, which is above and beyond just direct treatment to any one individual patient. The schematic on the screen operationalizes the 5 A's and applies them to all tobacco users. At the far left is the 5 A's applied to those assessed as willing to quit, and as you will see, it shows that they should be assisted by a healthcare provider providing appropriate evidence-based treatment. Those assessed as not willing to quit on the right-hand side of the screen are given an intervention to increase their motivation to quit, and that would be the assist part. Those assessed as recently quit or as facing ongoing challenges to abstinence are provided relapse prevention as their assist, but all are provided follow-up. So let's talk in more detail about each of the 5 A components and how you can ensure you're doing them accurately as you provide patient care. The first A, ask, is to systematically identify all tobacco users at every visit. Ask every patient whether they use tobacco at every visit. This is important if you're working in a health system for any type of health concern, whether a patient comes in for a flu shot or they come in for cancer treatment. You need to ask every patient whether they use tobacco at every visit. It's important to add this intake form, ensuring that it is seen as a vital sign at your system. In addition, ask what type of tobacco, how often, how long they've been using. Remember to ask about all types of tobacco, including hookah and e-cigarettes, because many people will answer no, honestly, because they don't see those as tobacco products. According to the clinical practice guidelines, you should implement an office-wide system that ensures that every patient at every clinic visit has their tobacco use status queried and documented. The next A is advise. It is very important that in a clear, strong, and personalized manner, you urge every tobacco user to quit. So say to your patient, it is important that you quit smoking, or you can say quit chewing tobacco. It is very important that you personalize these statements. Tell them that it's important that they quit and that you and your staff are there to help. You want your message to be very strong. Say, I need you to know that quitting smoking is the most important thing you can do to protect your health now and in the future. And once again, really make sure that you have personalized this. As you're discussing their health status with them and providing care, listen to the things that you can tie their tobacco use to. So you want to make sure that you mention current symptoms and health concerns, or tie it to social and economic costs, or the impact of tobacco use on their children, pets, or others that you have heard them say they care about. It's important to say something to your patient, such as continuing to smoke makes your asthma worse. You really, really want to ensure that you highlight things that are important to them and make it personal for them. Maybe they're concerned about the amount of ear infections their child is having. So you could inform them that quitting smoking may reduce the number of ear infections their child has. The next step in treating tobacco dependence is to determine the patient's willingness to make a quit attempt. Simply ask your patient if they are willing to give quitting a try. In doing so, you will have to be prepared that they are not ready and be prepared to provide them support, and as such, assessing and assisting do go hand in hand. If the patient is willing to quit, help the patient develop a quit plan, recommend the use of approved medications, provide practical counseling such as anticipating challenges and giving them tips on how to build on past success and avoid triggers. So you really want to provide a supportive clinical environment which encourages the patient in his or her quit attempt. It's imperative that someone on the clinical team provide supplemental materials, be prepared to educate them in depth about medications, if not contraindicated, and have procedures in place to refer them to the Michigan Tobacco Quit Line, which I will give you more information about later in the presentation, or other evidence-based tobacco dependence treatment programs that you may know of in your community. If the patient clearly states that he or she is unwilling to make a quit attempt, this is when you can utilize motivational interviewing strategies, as well as hand out health education material, ask follow-up questions, and you can still refer them and make them aware of evidence-based tobacco dependence treatment resources so that when and if they are interested in the future, they do know that they exist. Continue to leave that door open for all your patients so that they know you're willing to talk to them about this, that you have information for them, and that you're supportive and interested in their health and want them to quit using tobacco. The motivational intervention strategies that you should provide for the patient unwilling to quit are listed here on the screen. And I would highly suggest that you know of resources or a key person on your staff that is trained in motivational interviewing, is comfortable and competent in that realm. If you're not or don't have the time in your daily work schedule to spend that much time with a patient, these are great skills to develop and great resources to take advantage of. It is very important as you're providing motivational intervention strategies that you express empathy with each of your patients, but particularly those that have expressed an unwillingness to quit, that you listen intensely and develop discrepancies. And on the slide here, for all of 4 of these strategies, there's examples of how you could operationalize those skills and things that you should say as you're educating your clients on why they should consider quitting, gathering information from them about why they're not interested in quitting at this time. And all this information helps as you continue to provide patient care to them in the future and hopefully can move them through, build their self-efficacy, and help them decrease barriers and move them through the stages of change so that they hopefully will be interested in the future in setting a quit date. All smokers trying to quit should be offered medications except when contraindicated. As you may well be aware of, there are now 7 first-line medications approved by the Food and Drug Administration to treat tobacco dependence. Many can be used in combination, and it's very important that each healthcare provider on staff know about the medication, know potential side effects, know how patients should be using them accurately, and be clear on how to get more information and have information ready and available to give to patients. It is important that medication be combined with counseling and intensive health education to work with patients in quitting using tobacco. Nicotine replacement therapy should be considered for anyone who smokes greater than 10 cigarettes per day, anyone who reports withdrawal symptoms during the past quit attempt. So this is where it is important to talk to your patients that are using tobacco, find out about past quit attempts, why they were successful, why they weren't successful, discuss with them medications they might have used in the past, their concerns about using medication, how much tobacco they do use, how many cigarettes they smoke, and when they smoke their first cigarette. All of that helps go into what you would recommend them to use and hopefully set them up for greater success. It is important to remember when prescribing nicotine replacement medications that each quit attempt is different. So it's okay to try the same medication again as motivations may have shifted. And all nicotine replacement therapy medications are not better than a placebo. When discussing nicotine replacement therapy with patients willing to quit, inform them that medications prevent and reduce withdrawal symptoms, allows time to develop strategies to avoid relapse, allows for controlled tapering of the nicotine, honestly reduces their exposure to carcinogens and cigarette smoke, and greatly improves their success of quitting. I think that most of the time healthcare providers can spend is really educating patients on the appropriate use of nicotine replacement therapy, expectations for side effects, and really how to use and when to use nicotine replacement therapy accurately. Later in this presentation, I will talk about the Michigan Tobacco Quit Line, and all the health coaches that interact with callers are educated about nicotine replacement therapy and can do lots of counseling around this topic, which supplements and enforces everything that you as clinicians are telling your patients. While assisting your patients, questions may come up about electronic cigarettes. So the next 2 slides in this presentation include information regarding electronic cigarettes so that you can educate your patients and be educated yourself. On the screen, you see the picture of an electronic cigarette. These devices come in many forms. They are disposable or rechargeable, and some may even be refillable. It contains a cartridge filled with liquid nicotine, flavoring, and glycerin or propylene glycol. When the coil heats, it converts the contents of the cartridge into aerosol, allowing the user to inhale aerosol containing nicotine or other substances. The reason I bring this up today is because the Michigan Department of Health and Human Services, as well as the federal government, does not see electronic cigarettes as a safe alternative to other forms of tobacco. That's because electronic cigarettes are not approved by the Food and Drug Administration to use as a quit tobacco device. It should not be marketed as a quick aid. Electronic cigarettes do not have dosage recommendations and have varying levels of nicotine. So currently at this time, the Michigan Department of Health and Human Services are very concerned about Michigan residents utilizing electronic cigarettes and very concerned about potential poisoning due to the nicotine cartridges. The next essential component of treating tobacco use and dependence is to arrange for follow-up contact, either in person or via telephone, preferably during the first week after the patient has set a quit date. This is something that many healthcare systems and provider offices are lacking, is systems in place to ensure that patients are contacted. But this is a very key component according to the clinical practice guidelines. And procedures need to be put in place at health systems to ensure that there is somebody's job on staff and a method to follow up with patients around their quit date to ask them about any problems they're having, any anticipated challenges, talk about their medication use and problems, and remind them about evidence-based tobacco dependence treatment resources, such as the Michigan Tobacco Quit Line. At this point, I'm going to revisit the assist stage of the 5A's and discuss specific resources that are available to help tobacco users in Michigan quit. These all complement the services provided by healthcare providers and can be seen as resources that not only help tobacco users, but also help healthcare providers. Clinicians, as you can see, really need to take advantage of resources that provide practical counseling. Many healthcare providers do have very tight schedules and lack of ability to use office time to spend hours with each individual patient. But key questions are important to ask in gathering information. So as you're assisting a patient in using tobacco, it is important to ensure that somebody on the staff has it as their job responsibility, is included in their performance evaluation, to spend time with patients asking them about tobacco use. The information that you gather assists in prescribing medication and referral to evidence-based treatment services. So on the screen, you see many questions that it is imperative to ask and things to keep in mind as you're working with a patient. You want to remind them on ways to be successful as they quit, and focus on past successes, showing them that they're capable and that they are gaining skills each time that they try to quit. It's important to remind them that for many, use of alcohol or exposure to other smokers can lead to relapse. It is key, as you see on the last bullet point on the slide, that you ask permission from your patient to share more information. This helps you in assessing their readiness to quit as well. Also, for your use, there are tobacco quit lines available to your patient. And these tobacco quit lines are here to assist tobacco users. And as I said, they assist clinicians as they work in conjunction and provide the treatment intensity that often cannot be provided in a clinical setting due to time restraints. So once you have asked your patients if they are tobacco users, documented it appropriately, advised them that they should quit, it is imperative that you provide them resources to facilitate their quit attempts. Tobacco quit lines are an evidence-based strategy to assist patients that use tobacco by increasing access to treatment, reducing barriers, or providing assistance in multiple languages, and before and after normal business hours. I want to point out that quit lines are staffed by health coaches or counselors that are trained in motivational interviewing techniques and have at least a minimum of a bachelor's degree. They have received clinical supervision and continue to have their work checked by a medical director. Quit lines really view every patient as a unique participant, and the coaches work with every caller according to where they're at in the stages of change. I want to tell you more about the Michigan Tobacco Quit Line. The Michigan Tobacco Quit Line is a service provided by a company called National Jewish Health, and this is funded by a grant from the Michigan Department of Health and Human Services. And you see the phone number on the screen, and it is key to point out that Quit Line, this Michigan Tobacco Quit Line, offers to all patients referrals to local programs and one-time counseling, self-help materials, and on the future slide that I'm going to show you, it tells you what patients can call and receive free intensive counseling. But I want you to know that every patient that you refer to the Michigan Tobacco Quit Line does receive helpful information, does get to speak with a health coach, and they will also get referrals to local programs. The Michigan Tobacco Quit Line will take referrals from anybody. You want to ensure that these referrals are adequately done, and later in this presentation I will talk to you about how to refer to the Michigan Tobacco Quit Line. But I want you to know that here on the screen, these are the different types of callers that the Michigan Tobacco Quit Line helps. And as I said, all callers to the Michigan Tobacco Quit Line receive information and referrals to local resources and services. Within 5 days of enrolling and successfully completing a basic call, they all receive self-help workbooks in the mail. And if a caller is qualified, they get numerous sessions, as you see here on the screen. General enrollees get 4 sessions, so 4 calls from a quit coach, but then they themselves can call, the patient can call into the Michigan Tobacco Quit line as many times as they want. Telephone coaching is provided to Michigan residents with Medicare, Medicaid, county health plans, veterans, and enrollees receive personalized advice on how to quit, information on medication, and assistance with choosing a quit date and creating a quit plan. Coaches assist enrollees with identifying and reducing barriers to quit. One of the biggest questions we get from healthcare providers is who they can refer to the Michigan Tobacco Quit line. And our answer is, always, you can refer anybody who uses tobacco to the Michigan Tobacco Quit line. The health coaches that answer the calls will determine what level of service the individual gets based on categorization. So it is important to point out that individuals with private insurance are not included in that service population. But the Michigan Tobacco Quit line will refer them to their insurance company for services, directly give them the phone number and transfer them as appropriate. So the list that you see here of who qualifies for the Michigan Tobacco Quit line counseling portion of it, so that's very key. Everybody gets information, but those listed on the screen here are the ones who qualify for the intensive sessions, 4 sessions, 4 calls, and then the difference being that enrollees that are pregnant will receive 9 counseling calls, 5 prior to delivery and 4 postpartum. Any patient that has been diagnosed with cancer is another key population. The uninsured and veterans, those on Medicare and those on Medicaid, including those on maternity outpatient medical service type of programs at Medicaid offices. As I said, most individuals with private insurance are not eligible for quit line services, including counseling or nicotine replacement therapy. However, anyone who calls the Michigan Tobacco Quit line, when they identify their insurance, the quit line is able to inform the caller on what services they're able to use through the quit line. And the quit line will then recommend that the caller contact their insurance company to find out what benefits they may have through their plan. The quit line does have the plan's number on file and will transfer the caller if appropriate. It is important to communicate this to your patients at the time of referral. However, the Michigan Tobacco Quit line can offer online coaching, text message, email messaging, free materials, and local referrals to any caller, and then direct the patient back to their insurance company for other covered services. So what we would like to recommend is that you refer all patients using tobacco to the Michigan Tobacco Quit line, remembering particularly that pregnant women, individuals diagnosed with cancer, and youth are all eligible for quit line regardless of their insurance status.
Patricia, this is Melissa. I just had a question in the chat since you're talking about the counseling and the NRT for youth. Is this available confidentially if youth does not wish their parents to know?
Yes, good question. It is confidential. Use of the quit line and nicotine replacement therapy, if it's not contraindicated, obviously, for use, is not disclosed to parents, though the health coaches at the Michigan Tobacco Quit line would remind youth when they're talking to them on the phone that if their nicotine replacement therapy showed up at their parents' address, their parents may ask questions. If when the Michigan Tobacco Quit line calls individuals, 1-800 number shows up on the caller ID, and it doesn't say National Jewish Health or Michigan Tobacco Quit line, but, parents may get confused or answer the call or something like that. So it is as confidential as possible, yes.
Okay, thank you.
Oh, yeah, yes, definitely. There are, in addition to the phone-based counseling services available from the Michigan Tobacco Quit Line, there is a new resource for you and your patient. In addition, it is the online program, which you see a screenshot here of the website and the web address at the bottom of the screen. This is in addition to the telephone-based coaching services. This online service, the enrollment form can be done online, which makes the phone intake for the Michigan Tobacco Quit Line counseling portion shorter because individuals can complete all the stuff online, the basic demographic information. Users of the online service have access to a dashboard where they can set and edit quit dates, track tobacco use status, and track their quit progress. They also have there's also a calendar function there where users can view upcoming appointments with the health coaches. Also, there are lots of health education materials available through the website, such as worksheets about how to set goals and journaling capabilities. And there are also tools to look at and track their nicotine replacement therapy orders that are coming from the Michigan Tobacco Quit Line. And there is a plethora of support services, such as online chats and forums, and the ability to read success stories from others that have quit using tobacco. So the Michigan Tobacco Quit Line online portion complements the telephone-based portion. Though a caller or a patient does not have to participate in both simultaneously, they can prefer the mode that best works for them and will help them be most successful. In addition to the online program, there is text messaging program, which, as you see here on the screen, it's available to enrollees of the Michigan Tobacco Quit Line. It contains over 300 messages, and these messages are related to support and relapse prevention, contain motivational tips and encouragement. Because these messages are customized by tobacco type and allow for two-way messaging, which means the individual receiving the message can respond back. These messages help assess mood and craving and tobacco status to really help make the counseling resources more intensive, more personalized, and more productive. These text messages can also remind individuals about upcoming coaching appointments, that their NRT has been shipped, congratulatory messages. So individuals calling the Michigan Tobacco Quit Line are automatically enrolled in this text messaging program. They must opt out at intake, but I will say that very few individuals opt out of this resource, and it has been found to be very successful in helping patients. A little more here on the screen. I know we're getting close to time, so I just want to say that the Michigan Tobacco Quit Line does offer nicotine replacement therapy. All patients are medically screened. The three resources that are available are the patch, the gum, and lozenge, and the callers choose one. This is free nicotine replacement therapy available to the uninsured, those on Medicare, those with a cancer diagnosis. It is important to know that for individuals that are pregnant and then prescribed nicotine replacement therapy by their healthcare provider, the form that you'll see in a minute, a doctor does need to sign that to say that indeed this individual can have nicotine replacement therapy. It's shipped directly to the patient's home. And you see here that it is only available to those 18 and older, so that is unless a healthcare provider does prescribe. I want to reiterate with the Michigan Tobacco Quit Line, it is a fax referral process currently. Soon it will be electronic and available through electronic health records, but currently it is an old-fashioned fax referral form, a paper form that can be found and printed off from the website listed on this slide. Nurses, medical assistants, psychologists, social workers, anybody can use this fax referral form. And within one business day of receiving this form, a health coach from National Jewish Health will contact the patient. Healthcare providers who refer patients to the Michigan Tobacco Quit Line via fax will receive a follow-up report on the patient's progress. Specifically, providers who receive a fax back will receive a fax back when the referral form is received, when the patient enrolls, when the patient receives nicotine replacement therapy, and when the patient completes the program or if the patient is unreachable. It is suggested that the provider include these faxes in the patient's record and use them as follow-up and discussion elements when they're working with the patient. This is what the fax referral form looks like, and it is important to complete it clearly. Specifically under the provider section, it's imperative to denote the contact name of the person that you want to receive these patient-based feedback forms. This can be a receptionist, a nurse, a medical record staff. Once again, we would encourage, as the clinical practice guidelines do, that this is a clear task denoted in someone's position description and clearly communicated to them as their role in tobacco dependence treatment. The healthcare provider licensed to prescribe must sign the form if the patient is pregnant, has high blood pressure or heart disease, and wants nicotine replacement therapy. Under the patient section, the bottom half of the form, a patient must initial and sign that he or she has been talked to about Michigan Tobacco Quit Line and does agree to be contacted. If they're not physically able to sign because you've talked to them over the phone or for some other reason, the form can be written on the form. It goes without saying a phone number is needed for the patient because that is how the health coaches at the Michigan Tobacco Quit Line will contact the patient. This is a great resource that's available here in Michigan. I encourage all healthcare providers to become aware of the Michigan Tobacco Quit Line, have these fax referrals on hand. There's also business cards and posters that can be requested directly from me, and my information is now on the screen. The Michigan Department of Health and Human Services Tobacco Control Program not only administers the Michigan Tobacco Quit Line, but in doing so, it has lots of other technical assistance and resources available to you, and is committed to assisting healthcare providers in implementing evidence-based strategies, effective in decreasing tobacco use rate, and reducing and eliminating the health disparities that exist related to tobacco use. I want to thank all of you for participating in today's presentation and want you to know that if you need any help in ensuring that your healthcare system, your office, your clinic is adequately treating tobacco dependence, the Michigan Department of Health and Human Services Tobacco Control Program is here to assist you. Thank you.
Okay, Mark, are you still on the line? Can you please open the lines for questions?
Yes, ma'am. Ladies and gentlemen, at this time, if you have a question, please press the number 1 key on your telephone. Again, if you have any questions, please press the number 1 key on your telephone. Our first question comes from Kuki Hartzell from St. Joseph's. Go ahead.
Hi, is this PowerPoint that you're showing on the screen, are we able to print this off?
This is Melissa from EMPRO, and we'll be sending the slides to everyone who is registered for the call.
Our next question comes from Elizabeth Glasser from Otsego Memorial Hospital. Go ahead.
Yes, I was just curious, when somebody has a private insurance, will they receive any counseling at all, or are they just directly sent over to their private insurance?
That is a very good question, and currently, due to funding restrictions, the way that the Michigan Tobacco Quit Line is set up is that those with private insurance are given a workbook is mailed to them. They're told about resources in their community, so they're asked some basic questions, and then they are given the contact information for a direct individual at their insurance company to be able to assist them with what's available through their insurance company. The Michigan Department of Health and Human Services is who funds the Michigan Tobacco Quit Line, and so as money becomes available, as we can afford more and more, we cover the cost of callers, but are currently unable to do it for all Michigan residents, and so that is how the list is created. Some private health insurances do collaborate and have a relationship and a contract directly with National Jewish Health to provide a quit line similar to the one that we do, and or they go in with the state and offset the cost. And so, but the Michigan Tobacco Quit Line, when any patient from Michigan calls in, that is all assessed. You do not need to memorize all of that, which is why we strongly encourage all individuals to be referred to the Michigan Tobacco Quit Line, because of all those nuances. They're always changing.
Our next question comes from Ashley Wakefield from Premier Medical. Go ahead.
We have a high patient population that uses hookah. Does the Quit Line do any work with hookah users?
There is currently no evidence-based treatment around hookah, such as to have some treatment policies in place. The Michigan Tobacco Quit Line follows treatment protocols, dosing instructions, all of the evidence, because they are staffed by a medical director and on-site healthcare providers that work with the health coaches to ensure that everything is in accordance just as all of their healthcare providers have to do. And currently, hookah users can call into the Michigan Tobacco Quit Line. It is considered a tobacco product, and they can get resources. What becomes difficult is the health coaches, just like any health educator or healthcare provider, it is a little more difficult to understand perhaps the barriers to quitting, the social implications, the use, all of that stuff. But the Michigan Tobacco Quit Line does ask about hookah use. It is considered a tobacco product, and therefore individuals using hookah will get motivational interviewing resources. All the health coaches will talk to them. Quit plans can be created, all of that. So it's very similar. It's not personalized for hookah like it would be for combustible or non-combustible products.
Ladies and gentlemen, at this time, if you have any questions, please press the #1 key on your telephone keypad. There are no further questions in queue.
Okay. I wanted to thank Patricia for this great informational presentation today. And thank you all for joining us for the Tobacco Dependence Treatment Best Practices and Recommendations conference call. The slides will be available. We're going to email them out, and they'll also be available on our website, and the recording will be available on our YouTube page within the next week. At this time, we'd like to pull up the evaluation questions. If you can please take a moment to let us know how we did by filling this out, we would really appreciate it. And you can visit our website to register for our upcoming webinars at www.mpro.org. Thank you again for joining, and have a nice afternoon.
Ladies and gentlemen, this concludes your conference. You may disconnect at this time.